Changes related to President Obama's Healthcare Reform Act lead to a call for an expansion of Medicaid in Florida. Sarasota Memorial Hospital is just one of the entities pushing for the change here on the Suncoast. SNN local news reporter Boxleitner explains what's at stake for patients.
Expanding Medicaid in Florida is a huge issue right now, affecting all healthcare providers, and the CEO of SMH, Gwen McKenzie, says the stakes could not be higher.
The Federal Affordable Care Act is bringing many changes to the area's health care system, but one major uncertainty looming for thousands of residents on the Suncoast is the status of Medicaid. Sarasota Memorial Hospital CEO Gwen McKenzie was in Tallahassee this week, urging lawmakers to voluntarily expand Medicaid.
There is a concern that the federal government will not continue to participate in the federal funding, and the legislators and the governor are concerned about taking federal funding that could disappear, and then you have the expansion of 1 million people on Medicaid, and then what happens?
If Florida extends Medicaid, nearly 1 million additional residents would receive health care coverage, and Sarasota County alone would receive an additional $362 million in health care funding over the next decade. Half of Sarasota Memorial's emergency room patients are either uninsured or underinsured.
We have about 65,000 uninsured people, and we would very much like to get some of those people insured for the dignity of having insurance, not using emergency rooms for primary care, and just get better care overall. Sarasota
Memorial partners with area agencies such as Senior Friendship Center and the Health Department to provide care for patients with limited means. While the Affordable Care Act has improved care for people with pre-existing conditions, those under 26, and seniors facing the so-called donut hole, McKenzie says it's also brought a new reality for the business side of the profession.
For hospitals and health systems and physicians, what's paying for this is reductions in our reimbursement to some extent. So we've already had a $10–11 million reduction in reimbursement this year.
And McKenzie is heading back to Tallahassee next week. She's scheduled to meet with other committee members as this Medicaid issue reaches the session next month. Reporting in Sarasota, Boxleitner, SNN Local News.
Another concern for the hospital, mandatory cuts to Medicare also mean SMH will see a $145 million reduction in federal funding over the next decade.